The Department of Managed Healthcare is the first government agency solely dedicated to regulating health plans and assisting consumers in resolving disputes with health plans. The department currently oversees more than 90% of the commercial healthcare marketplace in California, including all HMOs, some PPOs, and specialized plans such as dental and vision. Its main functions are to monitor and regulate HMOs, provide information to consumers, and enforce state regulations when they are violated. The set of laws that regulates HMOs within the state enforcing by the department is the State NOx Clean Health Care Service Plan Act of 1975. That contains a plethora of regulations regarding consumer protections, access to care, specific service coverage, prescription drugs, grievances, licensing of plans, and reporting by health plans. The term managed healthcare is used to describe a multiplicity of systems intended to decrease the cost of providing health benefits and improve the quality of care for organizations that use those techniques or provide them as services to other organizations, or to describe systems of financing and delivering health care to enrollees organized around managed care techniques. After the 1980s, managed care plans and strategies thrived and quickly became nearly universal in the U.S. However, the rapid growth led to a consumer criticism because many managed care plans are provided by for-profit companies. Their cost control efforts created extensive awareness that they were more interested in saving money than providing health care. The department goal is to make consumers aware and informed when it comes to their health care options. There are many functional offices within the Department of Managed Healthcare that run the company with the mission to work toward an affordable, accountable, and robust managed care delivery system that promotes healthier Californians. The organization's vision is to have nationally recognized healthcare policy experts and establish national benchmarks for health maintenance organization regulation, policy, patient advocacy, and consumer awareness. The human resource at the Department of Healthcare has many responsibilities. It provides departmental personnel and payroll services such as benefits, transactions, position control, classification and pay, examinations, labor relations, workers' compensation, and supervisor consultations. It also provides administrative and management support services to department staff, including administrative policy and procedures oversight. Its human resource is effective and efficacious with the operational aspect. It has limited significant weaknesses, but it will not impact the overall organization. However, one of the challenges that human resource faces is inadequate staffing. Having sufficient staff is necessary to carry out the workload in its dynamic environment. Therefore, human resource should focus on recruiting employees that would benefit the organization.
The Department of Managed Healthcare, located in Sacramento, is a vital part of California's Health and Human Services Agency. The DMHC, a governmental entity, regulates health plans, protects the rights and responsibilities of their customer, and helps members and providers resolve any issues they may face. The department strives to provide the best service to their internal and external customers by ensuring aggressive prevention and high-quality health care, as well as providing a cost-effective regulatory oversight. Our consulting group's focus for this project is to ultimately find and strengthen any weaknesses that currently exist in the Department of Managed Healthcare. Using the information gathered in our research and interviews, we found that the department has strengths in overall retention rates, which is potentially the result of high levels of satisfaction and motivation. The department offers a great benefits program, which creates a higher comfort level for the current workforce. However, the department is lacking in their recruitment strategies and their hiring process. The Department of Managed Healthcare at the beginning of each fiscal year is given the opportunity to budget in and establish new positions. During our interview, we discovered many positions within the department remain vacant, which could be attributed to the expansion of the department, attrition, and the creation of new employment opportunities using a BCP process. In order to remedy these issues, our group has proposed improvements to the hiring and recruiting strategy. Our group recommends management implement new procedures in order to fill the vacant positions and improve the current workforce.
Our main focus chosen for the Department of Managed Healthcare is recruitment. Recruitment is a process by which organizations locate individuals to fill job vacancies. A recruitment process includes planning, strategy development, activities, evaluation, and philosophy. The Department of Managed Healthcare gives a great description regarding their vacancies, which makes it simple for candidates to determine the alternatives. Recruitment activities involve, for example, ads and campus visits, which help select employees. DMHC attends various colleges and universities in search for interns or employees. This is a great activity to offer valuable opportunities for students seeking to gain experience or seeking a job out in the real world. Some advantages of external recruitment include bringing new ideas and talents to the organization, whereas a disadvantage for external recruitment involves resulting in misplacements, which leads to increasing the organization's cost and higher turnover. On the other hand, internal recruitment has advantages such as company knowledge of goals and needs, and also employees have improved morale. For example, we interviewed Krishna, who works for the Department of Managed Healthcare, as she was recently transitioning from the exams analyst position to the personnel analyst. Since she had worked in the same department before but was in transition, the advantage was her already attaining the knowledge of the organization's needs and goals. Disadvantages of internal recruitment are having the same ideas and not implementing new ones. Job description provides an outline of the responsibilities, duties, and tasks to be fulfilled by employees. Job specification outlines the KASOCs, which are the knowledge, ability, skills, and other characteristics that is needed for the applicant. The Department of Managed Healthcare provides a job description as well as a job specification for recruitment in order to fulfill their open positions. They provide a list of position vacancies as well as with its job description and requirements. It is understood that DMHC has approximately 45 positions that are vacant either through attrition or they are newly created positions and have yet to be filled. DMHC should implement new procedures in order to fill those vacancies more quickly and increase their workforce. The situation of recruitment exists because human resource planning seeks to place the right employees in the right jobs at the right time and at the lowest possible cost, thereby providing the means for the organizations to pursue its competitive strategy and fulfill its mission.
When sporting teams and work teams have plans to improve themselves or simply have a vacancy, the coach or manager usually calls in a specialist to find new talents. In companies, that specialist is the HR or Human Resources Manager. HR staff kick into action and start the search for interested recruits. Recruiting is a huge part of making great teams. From the group of wannabes, HR staff use their knowledge and experience to find the best person for the job. HR managers are a vital link in the company's overall structure, making sure that the people match the company's purpose. But human resources staff do much more than find stars for the team. They provide expert advice to managers about how they can improve their team's performance and suggest training options to optimize staff potential. HR staff also monitor well-being, look after safety needs, and sometimes act as intermediaries. Both sides need HR when differences arise. And importantly, they make sure people get paid fairly. They then follow up to ensure when jobs change, so does the pay. Keeping capable staff saves time and money in the long run, so HR managers play a big part in staff retention. In a big company, helping people along a successful career path is part of this responsibility. HR managers can make a big difference when they connect the right people. They help shape the business by facilitating change. Then everyone benefits. HR experts are employed all over the world, which allows for great overseas employment opportunities. So in summing up, human resources recruit team members, advise on team performance, oversee staff training options, monitor well-being, facilitate change, organise salary payments, and resolve grievances. Your training starts here.
Based on our research and findings to the sit-down interview with the Department of Managed Healthcare in Sacramento, our consulting group came to a consensus that the organization could benefit from a better development recruitment strategies and hiring process. We would recommend a thorough examination of these procedures and possibly a reconstructing of the current process in order to ensure the department effectiveness and efficacy. As a group, we felt that the current problems not only affected the company as a whole, but affected potential job seekers as well. The goal of early recruitment activities is to attract a large pool of qualified applicants to an organization. Some research at the individual level of analysis suggests that the early recruitment practices may affect organization-level recruitment outcomes. Due to their lack of recruitment strategies, they are not receiving the necessary applicant pool that accurate recruiting relies on. Therefore, we recommend that they do more job advertisements to expand their audience. Not only would they like to see more campus visits, in order to successfully implement and attract number of job seekers, the Department of Management Healthcare would like to implement attractive job advertisements. The Department of Managed Healthcare can implement this through advertising in newspapers, internet sites, job fairs, and campus recruiting, just to name a few. Another recommendation that would benefit this department is to implement and increase internal recruiting. This hiring strategy not only would save them money, but also create an easier transition from one position to another.
Are you an alert guy or girl who is always up to date with what's going on in the world? Especially when it comes to technology and communication? Then you might be exactly the person we're looking for. Just visit intel.com/jobs to check out our exciting job offers. Our application tool makes submitting your information safe and easy. And then it's just waiting. A little while. Our recruiters take time to scan all applications and look for people who could fit into our crowd. And if you are the right candidate, we make sure to get to know you better. Then you can prove yourself in a personal interview. And maybe we can celebrate your first day at Intel together soon. So don't hesitate and start changing the everyday, every day. Visit intel.com/jobs and apply now.
The Department of Managed Healthcare, established in the 1970s as part of California's regulatory system, and appears to be a fairly well-run agency. However, we found that the department lacks in its ability to fill vacant positions. This is why we are recommending that the DMHC change their recruiting strategy by doing more campus outreach, increase internet advertising, job fairs, and using employee referrals. When the department is able to fill their vacant positions, they will be better able to continue their job of regulating commercial insurance companies long into the future.